Hi, everybody. Welcome back. So, today we're going to be getting into our legs. I have a really yummy treatment for you. So, I got my little yoga strap, and you can use anything. It can be a belt, a towel, it can be a rubber band, whatever you have handy. So, don't worry too much about that. So, we're going to be working with our tight legs. Don't we all have them, right? Especially with the hamstrings today. So I'm laying down because we are going to be on the floor. And if you cannot be on the floor, get on the couch or a bed, it's okay. Firmer surface is always good. You know that, right? Okay, I'm just gonna lay down on the back. So I'm just hanging out here on my yoga mat so you can see me. And I'm just gonna just slowly take a few breaths. Allow myself to relax, soften into the ground, not thinking much of anything. I'm feeling the pressure on my back. I'm feeling my sacral bone, my backbone, sinking into the floor, releasing, relaxing. It feels really good to start with just rolling that sacral bone on the floor, on the surface, just to stimulate your relaxation, stimulate some nerve connections, help you get into this treatment today. It's a really good idea to just set ourselves for success by relaxing, taking a minute before we get to the technique, just breathing. And remember, you can always play some music when you're self-treating. You can always set up a very special place, maybe in your bedroom, somewhere where you really like to spend time. Make it like your sanctuary so that you can really take time, you can really enjoy what you're doing every day. It is a part of your success in this 21-day challenge that we are going through. So I am just rolling a little bit my sacrum still. And now I'm going to grab my strap when I'm ready. And I'm going to pick one leg that I want to treat. I'm going to be doing the right one, but you can pick whichever you like. Remember, we're going to be spending at least 5 minutes on each leg. In this video, I'm going to go slower. I'm going to spend less time on straight, but when you're self-treating, remember to have a watch, a clock, a timer to not cheat, to make sure you are spending the 5 minutes. So as you see, I just wrapped this strap around my foot, okay? And I'm just going to hold on to it, not too hard, but just gently stretch my leg. And if you can only go that far or maybe that far, it's just fine. So do not force it, do not push it. It's not about stretching your hamstrings to the max. It's actually about connecting with the back of your legs. My hamstrings are very tight, so comfortably I can only go that far. So you see my knee is a little bent. And one very important thing, you want to keep your back and your hip on the floor. You don't want to be raising yourself up or pulling too hard. So you want to have that back of your hip stuck onto the floor so you can really go and get into the back of the leg to help it become softer, more relaxed, more stretchy. So I'm just gently holding onto my strap and just allowing it to support my leg so that I don't have to use the muscles of my leg to be holding myself up. Okay, that's what the strap is for. So just to give it support. And of course, as always, we're just breathing into the tissues, slowly relaxing, letting go, imagining that fascial structure, the connective tissue running through the back of your legs, softening. Let it soften slowly, letting it slowly elongate without forcing, without making it stretch. And as I'm staying here, as I'm feeling it, I'm actually starting to feel it, feel the stretch extend into my calf all the way here. And I'm actually feeling it into my foot, right? So my foot is getting a bit of a stretch. It's actually a wonderful treatment for plantar fasciitis. It's also a wonderful treatment for your lower back pain because oftentimes our hamstrings are so tight that they immobilize the back. So we don't have enough mobility and we don't have enough space in our back to move properly. So if you're suffering from back pain, if you're having issues with your feet, or if your legs are just simply tight, this is a fabulous treatment. So see, I'm slowly actually starting to extend my leg a little more. I'm not forcing. All that I'm doing right now is just waiting. So we have to be very respectful of our fascial system. It does not respond well to force. It does not respond well to overstretching or making it do anything. It's very stubborn that way. But what works well with the fascial system is allowing it to soften and let go on its own time. So here I'm just hanging on. Whew, it feels pretty good. And I'm feeling more and more space opening in the back of my leg. And honestly, I'm starting to feel some burning, some achiness in my hamstring. It's a good feeling of a good pain, like it's productive. So I'm not forcing it. I'm not trying to feel pain. I'm just staying with it. And now, because it's stretched out a little more, I'm feeling that soreness or that achiness that I experienced for a few seconds actually subside. It's starting to feel like I am getting more and more space in my leg. And I'm feeling a bit of a sensation of warmth and heat in my foot, in my ankle and the back of my foot. So wonderful. Ooh, yeah. So like I said, we can hang on in here. And if you want to move a little bit, you can always move to the side. It would be another 5 minutes, honestly, if you want to go all the way to the side. Or you can go out, right? I have a wall here, so I'm not going to go too far, but never force anything. So ask yourself, which way do I want to go today? What will feel most productive to create more space in my leg, in my foot, in my back? And when you're ready, you can slowly just release, relax, bend your leg back to neutral. And then, it's always a good idea to maybe feel that shape of your body on the table or on the floor. And you can go back to how we started with just rolling the sacral bone on the floor. And when you're ready, slowly getting up, just rolling on your side. You can stay in a fetal position, just integrating. Okay, it was a pleasure hanging out with you today, and I will see you tomorrow. Bye-bye.